Hi, my name is Satvika Reddy. My uncle is 34 years old. He started getting chest pain for about 2 weeks. Then he went to hospital. They did angiogram and confirmed blocks in heart and suggested bypass surgery. He went to other hospital. They said there is no block in heart but advised blood thinners. In third hospital, they said thyroid problem and vitamin D deficiency. In fourth hospital, they said vitamin D deficiency and calcium deficiency. So why there is so much confusion about this chest pain? Why different doctors having different opinions about the same problem? Let us try to find out a solution for this from Dr. Sudhakar Reddy.
Thank you, Satvika, for asking such a common problem commonly faced by a common man. Why so much of confusion? Why so many different opinions about the same problem? I think in your uncle's case, in the first hospital, wrong diagnosis was made. Forgetting the basic causes and basic investigation, they jumped straight away to the heart attack. In the second hospital, no diagnosis was made. In the third hospital, probable diagnosis was made. And fourth hospital, I think correct diagnosis was made. But the question remains, what if he has believed the first hospital and underwent bypass surgery? Another common problem happens with chest pain is by focusing too much attention on single problem heart attack, which may not represent more than 6% case of the chest pain, or ignoring one of the common causes of the chest pain, that is constitution, in not less than 50% case of the chest pain. Myself, Dr. Sudhakar Reddy Tirupati, pediatrician with more than 30 years of experience in modern medicine and 14 years of experience in homeopathy, which I call spiritual medicine, and little experience in acupuncture and Kundalini yoga. My mail ID, try incurable, you may find interesting, but it doesn't mean that I cure every incurable disease. No, definitely not. But thanks to the present day health situation of the people, of the disease management system, mostly disease is managed, rarely cured. I am able to succeed in at least 7 or 8 out of 10 people in so-called incurable diseases. Of course, I did not include any cancer patients in my study. The topic reality of chest pain I have divided into 4 parts. First one is, what is the chance of heart attack when somebody gets a chest pain? Second one, stable chest pains means somebody having the chest pain which is not emergency, where he has time and option to cure and reverse the heart disease. Third part, what are the common myths about the chest pain? And if somebody gets a chest pain, what he can do to mitigate or ease the acute or emergency in the heart attack? And frequently asked questions. Number 4, the role of constitution in chest pain and how it is cured with the constitutional remedies. Coming to the first part, what is the chance of heart attack when somebody gets chest pain? There is a lot of confusion about chest pain, lot of confusion created about chest pain. If you listen to any video on social media or read some news article or newspaper, are you feeling clarified or confused? Do you feel reassured or scared? I think it is very relevant for me to mention a quote here, which I appreciate very much. I borrowed it from one Dr. Sanjay Gupta, cardiologist from York Cardiology. In a YouTube video, what I believe he says, the media, pharmaceutical industry and healthcare industry profit by promoting fear rather than providing reassurance and empathy. He also says, I want people to stop being fearful and anxious about their health. This is one of the newspaper article I have seen recently. It says, don't ignore any symptoms, say experts. I am sorry about the less clarity of this slide. Same thing I mentioned in this slide. What it says is compression and pressure in the center of the chest lasting from minutes to hours, and non-chest pain coming from the jaws, neck, shoulders, both arms and upper abdomen. Also, sudden nausea, dizziness, recurrent indigestion or heartburn. Don't ignore. This statement may be right on some occasions, but I feel this is wrong on more occasions. How? Let us analyze one symptom, heartburn. Heartburn is a symptom of, say, gastrointestinal tract in about 99% of the cases. And 1% of cases it may be attributed to the heart attack. A specialist often needs investigations to find out the cause of heartburn, at least in some cases. How can a common man rule out all the causes of the gastrointestinal tract and recognize that 1% of the heartburn related to the heart attack, which in turn, heart attack may not constitute more than 6% of the chest pain? Confused? Yes, I am also confused. The idea of my presentation is only to minimize this confusion. Some people may say heartburn associated with heart attack is usually has associated shortness of breath or sweating or weakness. Agree. But I have seen many number of cases of heartburn also having the same symptoms. It becomes very easy for a specialist to say that symptoms because a patient comes and tells the symptoms. There is nothing wrong in mentioning them. But how can a common man recognize all these symptoms and recognize that rare causes pointing to the heart attack? It becomes very difficult unless some constitutional expert studies his constitution and recognizes those symptoms which are part of his constitution and makes the common man aware of. Because constitution is one thing which plays a bigger role than any other known cause in chest pain. Let us analyze this in another way. You see these symptoms on the left side: constriction, stiffness, heaviness and burning, and atypical symptoms which I just now described, and angina. Angina means somebody getting chest pain on exertion or on walking, and it is relieved on taking rest, is known as angina. All these symptoms may indicate an heart attack, true, but in not more than 6% of the cases of chest pain. But everybody talks, everybody highlights them. See the right side, same symptoms but not related to the heart attack, happening in at least not less than 50% cases of the chest pain, and nobody talks about them. Why? By giving too much attention to the same symptoms attributed to the heart attack happening in not more than 6% of cases of chest pain, and paying no attention at all for the same symptoms attributed to the constitution but not related to the heart attack, how much anxiety is created in their minds? And who will answer those questions? Who will answer their questions? And what is the financial and emotional cost of that anxiety created unnecessarily? A study was done in Harvard University in 2015. It says anxiety increases the risk of coronary artery disease by 21%, turning it fatal by 21%. Hippocrates, father of medicine, 460 BC, described 4 types of humors. Later, Galen, based on these humors, he developed 4 types of constitutions. To understand constitution, one must have aptitude, training and knowledge. because constitution plays a bigger role than any other known cause of chest pain, and for that matter constitution plays a bigger role than any other known causes in many of the chronic ailments of the humanity. According to Paracelsus, Swiss physician, no knowledge is perfect unless it includes the understanding of the origin, that is the beginning. And as all man's diseases originate in his constitution, it is necessary that his constitution is known if we wish to understand his diseases. Constitution includes all the characteristics of a person, his physical and mental makeup, his likes and dislikes, his reactions to the environment and situations, and his emotional and intellectual attributes. Constitution is important tool to balance and maintain health, to prevent sickness, and to fight sickness, particularly diseases like COVID. I repeat, Constitution is one of the very powerful tool to fight diseases like COVID. If somebody gets COVID, he will not develop symptoms of COVID. It appears mysterious. I admit that it does, unless one understands what is known as constitution, because the patient responds to the COVID with the symptoms which are there in the realm of his constitution only. If a doctor is trained to understand the simple fact and the symptoms presented are specific to the individual which are there in the realm of that particular individual, and same symptoms help in identifying the matching constitutional remedy that cures the COVID. And this simple step reduces the mortality rate drastically in COVID cases, or reduces the death rate drastically in COVID cases, and prevent unnecessary hospitalizations. This is my experience of treating COVID cases for the last 3 years. And my article is published in International Journal Echocardiogram in April 2022, Constitutional Remedy in COVID-19. Those who are interested can go through. And my experience is at least 70% of people we can clear-cut make out the Constitution. If a physician understands a disease, he may cure some of them. If he also understands the person and his constitution and his user's manual, he will cure most of them, particularly in chronic diseases. This is my experience. What is the chance of heart attack when somebody gets a chest pain? Is it 100%, 75%, 50%, 25%, 15%, not even 10%? It is only 5%. Of the 5%, 1/5 are widowmaker heart attacks, means the person dies during the heart attack. And 1/5 are silent heart attacks, means the person even doesn't know when the heart attack came and went. So only 3% remains. Of the 3%, try to find out whether you have unstable or stable. Stable constitutes again more than 1.5%, where you have time and option to cure and reverse the heart disease. So you are only left with less than 1.5% of chest pain, which is unstable, which is usually an emergency, where the pain usually gradually ascends or increases in severity. And in that case, try to find out these two things if possible. Number one, try to find out whether the block is in one of the major artery which supplies blood to the heart, that is left anterior descending artery, and whether any ST elevation in ECG, what we call STEMI, ST elevated myocardial infarction, because in these two things, usually the emergency is more or chance of death rate is more. So take the advice of healthcare provider, whatever he advises, you follow. So in essence, in 97 to 98% of chest pain cases, you need not worry. So what are the known causes of chest pain? Has anybody done any study? Yes, there was a major study done in USA, one by Dr. Rini Vaishya et al. From the University of California, San Francisco, Department of Emergency Medicine. And their results were published in Journal of American Medical Association in 2016. They have included all the adults from 18 years and older from January 1st, 2005 to December 31st, 2011, who all came with the complaint of chest pain. They included all those people, and there are about 10,907 patients who came to the emergency departments with the complaint of chest pain. And the conclusion of the study was this: more often than not, chest pain doesn't signal a heart attack. In only less than 6% of the patients coming to the emergency department with the complaint of chest pain had a life-threatening heart issue. And in about 5,624 people out of 10,907, that is 51.7% of the case of chest pain, the diagnosis was non-specific chest pain, means they did not know the cause for the chest pain. They did not understand the cause for the chest pain. The same figures are analyzed in a pie chart. It appears like this. See the green color, 54% represents a non-specific pain where they did not find the cause for the chest pain. 14%, that is in pink and red, represents cardiovascular, means causes related to heart and blood vessels, which includes only 3% of heart attacks. I repeat, 3% of heart attacks in 100% of chest pain. And blue color indicates respiratory causes, which is double the incidence of heart attack, 6%. Causes of lungs and airways. And brown color, 4% represent gastrointestinal causes. And gray 1.5 represents muscles and bones, musculoskeletal. Remaining 20.5% were miscellaneous and panic attacks. But according to my experience, if a doctor understands what is known as constitution, most of this non-specific pain doesn't exist. It ceases to exist because most of them, they come under the group of constitution. This is my experience. And also this 20.5% of panic attacks and miscellaneous, and also some fractions of gastrointestinal, respiratory and musculoskeletal come under the constitutional group. And the constitution is one which you cannot measure on any laboratory investigations. You have to understand the person. And there is no shortcut to knowing the constitution. One must learn the science. I am not putting forward any hypothesis. I want to put forward examples of the chest pain coming based on the constitution and how I treated with the constitutional remedies, which I am going to present in the fourth part of this presentation. So finally, does your healthcare provider understand your constitution? What if he is ignorant of the major cause of the chest pain? What if he is not trained to understand that major cause, constitution, and labels it as non-specific? What if you have that non-specific pain and your healthcare provider has to manage that pain? Whether one likes it or not, accepts it or not, understands it or not, we are in such a health scenario today. If you want to know more details about constitution, please refer to my video presentation on YouTube, Nail Designs by Nature. Finally, I have to make a disclaimer. The percentage figures which I mentioned in this causes of chest pain are not exactly accurate. They are only approximate figures. And this information is only for educational and awareness purposes only. Please consult healthcare professional. If you have a stable chest pain where there is no emergency, consult a constitutional expert. And if you have an emergency or acute attack of chest pain, please consult a specialist. And please consider subscribing and sharing if you are convinced that this is truthful and useful information different from the routine. And also if it is useful to you, your family, your relation and your circle of influence. And if you are interested in such videos, please do subscribe. Thank you very much for your time. Thank you for watching. See you soon in my next video.